People call me Stimpod Stan, and we are currently up in Alaska because one of the business models that works phenomenally well for our clients, we fly to their clinic. So instead of having a medical device where they sell it to the clinic, sometimes they pat them on the back and wish them well, that's not how we do business. Most of our clinics will buy a 6-pack of Stimpods, and included in that 6-pack, we are going to fly one of our experts up to spend 2 days at your clinic. Case in point, I am currently up in Alaska on a cruise ship. We started in Anchorage with the largest PT clinic up in Alaska. I flew Jeremiah up, and we spent last Wednesday and Thursday at the clinic. We did 3 neuropathy workshops. We had 40 people at each of them. It was crazy the amount of people that suffer with the symptoms of neuropathy. And we have found that it's incredibly effective when we get a bunch of those people together. So the clinic will promote the fact that they have an expert flying in that's going to be here for these 2 days only. We're going to be discussing and demonstrating state-of-the-art treatment to help with these symptoms. And they always pack the place, and it just works incredibly well. When we're flying in to spend 2 days at a clinic, we are there for that clinic owner. And the patients love, whichever doctor I bring with me, patients love them. And it's really effective because we don't give a lecture. We actually go back and forth with the people in the room, and we let them feel what Stimpod feels like. Because I don't know if you know anybody that has diabetes or suffers with neuropathy, but there's a lot of hopelessness out there because historically they're told by their other providers that we got nothing for you. And they'll put them on some pharmaceuticals. Usually it's gabapentin or something like gabapentin. And it's not doing anything to help the underlying condition. It's just masking some of those symptoms. So we like to really help them. And during the workshop, they get to actually feel Stimpod. It's funny, part of the workshop we mentioned, during the next 90 minutes, we don't have enough time to fully treat all 23 of you who are in the room, but I want every one of you that's taken your time to be with us here today to feel what Stimpod feels like. So we're going to ask you to come up, and we're going to ask you which leg is worse, and we're going to treat that worst leg. So the way we do workshops are incredibly effective. They're very efficient because instead of just talking one-on-one to a patient, you're actually able to deliver this story to 20 or 25, typically very similar patients. That's why the workshop model works so well. And that's why we feel it's so important to fly in, because not all of our clinicians have done workshops before. Some of them tell me the story, back in the day, we used to do the dinner workshops, and, some of them had good outcomes. Others say, we bought dinner for a bunch of people, but that's all that ended up happening. So we kind of have a new paradigm, a new way of doing it, and we're really good at it. And it works incredibly well for the patients because it's all about the patients. And I tell these docs, you know what? If you want to improve practice income, the best advice I can give you, improve patient outcome. That's really the name of the game. When we do workshops, they are not lectures, they are interactive. We want the people who have come to the workshop to have hope again. We want to put the Stimpod on their leg for 5 minutes, and then we put Stimpod on their ankle for 5 minutes, and then we ask them to walk around and let us know what they feel. And typically at the end of those 10 minutes, we hear comments like, wow, this foot feels totally different from my other foot. I can feel the floor. I can feel the temperature of the floor. That's the beauty of using Stimpod in that environment. And When you have 20 people there, you've just built a tribe, because now people hear similar stories. Because the first thing we like to do is go around the room and hear stories of what their why is. Because the fact is, the problem that neuropathy causes, and the fact that you have numbness or tingling or pain in your feet or legs, that's really not the reason that they want a solution. They want a solution because they want to be able to do the things that those painful feet and legs are keeping them from being able to do. That's why we're there. We want to show them that, you know what, maybe other providers are telling you that all they have is pharmaceuticals. We've got a way of helping to treat the underlying condition. Our goal is to help you get back to being able to do the things you love to do. So an analogy of what Stimpod does, okay? Pretend like you're having a bad day with your computer, okay? It's running really slow, the hard drive is freezing up, you get super frustrated, you pick up the phone, you call tech support. What's the very first thing they tell you to do? Reboot your computer, ma'am, unplug the modem, restart the router. In essence, that's what Stimpod is doing to the nerves. If we have a nerve that's expressing nociceptive pain, we're rebooting that nerve. If we've got a nerve with a condition like Bell's palsy, well, we're not trying to resolve pain. With Bell's palsy, half of your face is going to be paralyzed. In that instance, we're going to those specific facial nerves, and again, we're trying to reboot those nerves. And so many times during the Stimpod treatment, patient is going to feel different. They're going to start to feel relief. Is it going to cure? No, we don't use the word cure. We are trying to help the condition and improve the quality of life. Are there some conditions that you only need a couple of treatments? Absolutely. Are there some conditions that you need a lot more treatments than that? Yes. Case in point, neuropathy. Typically for diabetic neuropathy, patient is going to sign up for a program that consists of coming into the clinic twice a week for 8 weeks to do the treatment in the clinic, or at the workshop, we explain the second option is for 5 of you guys to be able to take one of our Stimpods home with you, and you can do the treatment in the comfort and convenience of your home. And instead of coming into the clinic twice a week for 8 weeks, with the home version, 6 weeks at home. And many of our patients get an even better outcome in 6 weeks at home. And from the practitioner's perspective, most of them charge the same amount of money, whether the patient's going to come in twice a week for 8 weeks and do treatment in the clinic, or if the patient is going to take one of your Stimpods home with them for 6 weeks. So given the choice of charging the same amount of money, and now you're providing 16 treatments in your clinic on your calendar, or hey, one of your Stimpods goes to somebody's house for 6 weeks, you're making money while you sleep, which is why you just got 15 appointments back that you can sell to somebody else. That's why the whole home version people love. Stimpod really does work. And so I encourage people, go to our YouTube channel, subscribe to it so that you'll see more and more videos as we get them posted. We like what we do. We're really good at doing it. We're always looking for, more clinics, because the more clinics we can help, the more patients, that can be helped. And it's a painful world out there. So the more people we can help to resolve the pain, the better. So that's why we're here. If you are somebody who's been suffering, with pain, with nerve-related issues, with neuropathy, and you are looking for a way of gaining help because what you've been doing hasn't been working. If you want to reach out to us, and you can find the contact info on our website, the stimpodstories.com website. We can let you know if we do have a Stimpod provider, in your area. That's the best way for you to be able to really see it and feel it in action.